Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates. With your host, Cindy Gellermini.
Hi, everyone. This is Cindy with another episode of Spectrum Perspectives. And today I have another autism mom, Becky Davila. Did I say that right? Yes?
Yes.
Okay. Hi, Becky. Welcome to the show.
Thanks for having me, Cindy. I'm so excited to connect with you today.
So we have a lot of important things that we want to get to, that we want to talk to you about health and everything. But let's start with your own personal story. Let's back it all up. You have 3 kids, correct?
3 boys.
Okay. So, a boy mom. Let's start with the first one, your oldest. What's his name?
His name is Nolan.
Nolan. Okay. So when you were pregnant with Nolan, were there any kind of red flags, anything that came up during ultrasound or anything that told you there may be an issue with the pregnancy, or was everything fine? How did that go?
Everything was going fine up until about 28 weeks. I developed preeclampsia, and they admitted me into the hospital at 30 weeks on bed rest, just because they were having a hard time stabilizing my blood pressure. So they just wanted to monitor me real closely. And so I was in the hospital from 30 to 34 weeks when I ended up delivering. So he was premature. He spent about a month in the NICU. And so that was kind of like the start of our journey. So right off the bat, emergency C-section, which we know he didn't go through the vaginal canal, wasn't exposed to the good bacteria, all the medications, the steroids, and things. So that already kind of started him off on a rocky start.
Okay. And how old is he?
He's now 11 and a half. He'll be 12 in March.
Okay. Did they give them that, were they giving them the inoculations like on the first day of birth?
First day of birth, and something interesting that I've learned since then is that the doses aren't weight dependent. So whether you have a baby that's born at 4 pounds or a baby that's born at 8 pounds, they receive the same amount of the medication.
And how much did he weigh?
He was a little over 4 pounds.
Yeah, so he's tiny.
Tiny guy, yeah.
Yeah.
Wasn't my tiniest though.
No. Oh no. But so even though he was in the NICU, they still jabbed him.
Yep. First day, I think he got Hep B.
Yikes. Okay.
Yeah. And back then I didn't know. I didn't know better. I just trusted it. And I took Tylenol throughout pregnancy because we were told that it was safe. I did take some antibiotics a few times for sinus infections. Knowing what I know now, I definitely would have tried alternative methods. But back then I was just doing the best with the information that I had and trusting the doctors.
Mm. And then how did his development go? Did he crawl on time and walk on time?
So he was actually pretty developmentally delayed since birth. So it was, and I was a first-time mom, so I didn't really know what to compare it to, what was a normal trajectory of development. So in my mind, I was like, well, he's just a preemie, he's going to catch up. But he was a really fussy infant from about 0 to 10 months old, very colicky, never wanted to be sat down. He always wanted to be standing upright. So if you were holding him, his legs would be really stiff in an upright position. He didn't nap until 10 months old, barely slept throughout the night. He was waking up about every 1.5 to 2 hours. Just super colicky. It was really hard to care for him as my first child. Finding the right formulas and all the things. He was just very sensitive. And then later on, we realized that he had a milk sensitivity that no doctors ever brought to our attention that could be a possibility. So we were, driving to Walgreens in the middle of the night, trying to find different formulas that would suit his stomach, because he was always seemed to be in stomach pain and had a distended belly, and I struggled with constipation throughout his first year of life, and then chronic ear infections, several rounds of antibiotics. It was just a really rough infancy, especially being, my first.
Mm-hmm. And so you didn't nurse?
I didn't nurse. I wanted to, and I tried. My milk just never ended up coming in. And I think part of it too was because he was in the NICU. whenever I was around him, I would get a little bit more milk production, but then when I was away from him, it
Mhm.
just kind of dwindled. So
Right.
I wish I would have pushed harder, knowing now what I know now about how important breast milk is. I wish I would have tried a little bit harder, but at the time, again, I was just doing the best with what I knew and the
Yeah.
resources that I had.
Yeah. Yeah. Okay, so was he developing speech?
No speech. So we actually he was born in Texas. I'm from Las Vegas originally, but I moved out to Texas back in 2012 it was, and he was born in 2014. And then towards the end of 2014, we actually relocated back here to Las Vegas. All of my family was out here, so I really wanted, I had this newborn. I wanted to be close to family. He had a cousin that was 6 weeks older than him, so I wanted to be close to my sister. And my sister was actually a special ed teacher. She did kindergarten through, I think it was third grade. She did resource. And she was actually the first one who said the A word to me. I
Wow.
was totally blindsided. I want to say he was around 15 months. It was during the summer. We had all the kids were out of like preschool and school, so we were meeting up at different play groups and things. And she noticed that he was walking on his toes, and he didn't have any speech at this time. Was developmentally delayed, but he did walk around 13 months. Even though he was delayed, he was still meeting the milestones. And I just kept blaming it on the fact that he was premature. Like, oh, he's going to catch up. He's a few months behind. But, I just figured that was normal for a premature baby. But he didn't have any eye contact, didn't respond to his name, didn't really show interest in any other kids, didn't show interest in playing with toys, and was just kind of lost in his own world. So we met up with her at this play place, and she noticed that he was walking on his toes. And I could tell that it was really hard for her to bring this up to me. She didn't want to hurt me or scare me. She was really protective of my feelings, but I'm so grateful that she worked up the courage to bring it to my attention because I truly believe that played a critical part in his progression just by being aware of it and getting the diagnosis so young. It allowed us to access services for him a lot sooner. So around 15 months, she brought it up to me. She said, "Hey, I don't want to scare you, but you should really go to your pediatrician. I'm just noticing that he's walking on his toes a lot, and it could be a sign of autism, but you should really go to your pediatrician and just, express your concerns and maybe get a referral for early intervention." So I went home that night and I told my husband what she had told me, and he was really upset. I think it's pretty common what I see with a lot of families is that one parent's usually the one who's kind of noticing the signs before the other parent does, and then one parent tends to be very defensive or in denial. And I think that's kind of where we were at, where, I was just wanting to figure out what's going on and how can I fix it. Whereas my husband's like, he's fine. He just needs time to catch up. But, as we both know, there's so much brain development that is happening at that time. So the earlier you can start these things, the better the prognosis. So I immediately made an appointment with the pediatrician. I think I actually called early intervention the next day myself and did a parent referral for myself to get the ball rolling. And so we started with early intervention, I think by 18 or 19 months. So he was pretty young still. And through early intervention, they were able to refer us to a developmental pediatrician, and he received the diagnosis the week of his second birthday. And my husband, still at that point, did not think that he was going to get a diagnosis. So I remember the day that I had the appointment to meet with a developmental pediatrician. My husband wasn't able to get it off of work, but he wasn't really concerned about not being there because he thought it was going to be fine, that there was going to be no diagnosis given that day. So we did end up getting a diagnosis, and it makes me a little emotional to talk about it because that night I went home and I ended up vomiting over 10 times overnight because I was just so sick over it. It just felt like you were mourning somebody that was still there with you. And I know that sounds kind of silly to say, but all of your dreams and hopes and expectations as a parent and your idea of what their life is going to look like just changes in that instance. So the fear really started to set in. What if I never hear his voice? What if he never tells me he loves me? What if he doesn't have friends? All those concerns that I think all of us autism parents kind of go through in those early stages of the diagnosis.
I said the same thing. I describe it as going through mourning,
Mhm.
really, because you have all these ideas and plans in your head, for
Oh, in my mind, he was going to be a baseball star.
yes, oh yes. I thought he was going to play for the Yankees. He was going to be the next Derek Jeter. He was going to
Yeah,
be, you think all these things. You picture them getting married someday and being a grandparent and all these things. And then all of that is taken away.
right,
And it's like, no, you have a special needs child. Like,
right,
wait, what? And it's not that you don't love the kid that you have any less. It's just, it's like the kid that you thought they were doesn't exist. It's like, no, you have this a different child. It's like, you know,
right. Very similar to that Welcome to Holland poem. I'm sure you've read
yes,
that one. Yeah,
yeah,
I think that's such a great description of the kind of the mourning that we feel as parents when we get that diagnosis.
right,
And
right,
in reality, they're the same child that they were before the
right.
diagnosis. But I think as a parent, just accepting that the trajectory of the rest of their life is going to be different than how you imagined it. It's a hard thing to swallow.
I see a lot of parents in denial too. I've run across that quite a bit. I'm like, let's just give it time. Let come back to
Yeah,
me next year and let's see if we have this same conversation, you know.
right,
And I think
right,
for men, um, I think it's a little bit of a blow to their ego a bit too. Like they can't handle that their son is not their mini me. And
right.
I address that in my children's book a little bit. Just because it's just something that I saw. I remember when Robbie was first diagnosed and he was in early intervention. And when the dads would come into the group, they were in such denial. And
Right.
where the moms are like, here we are in therapy, we're doing what we have to get done. And so many moms are like, could somebody please just get this through to my husband because he's just not getting it. It's very
Right.
common for some reason.
It is. It is.
Okay, so all right, so we've got the diagnosis. So what next?
Okay, so after he was diagnosed, we jumped right into ABA therapy, which I know is a little bit controversial. And knowing what I know now, I probably would have gone a different route with him. I do think that there was a lot of benefit to ABA. So the kind of ABA that we did was more of the early start Denver model, which is not quite as structured as your typical ABA. It's a lot of play based,
Mhm.
but it's still the core principles of ABA, which is like withholding things based on his behaviors or not responding to his emotions. And at times that became really hard for me when he was crying for me upstairs, and the ABA therapist would just be ignoring him. And it got to a point where it's like, well, don't we want him to communicate and want him to want to interact with us? He's calling for me. Why are we just going to ignore him? And that was kind of a pivotal moment for me. Like, this is not humane. This is not right. If a 3 year old is crying for their mom, that's a typical behavior for a 3 year old. Why are we just going to ignore this? And so there, like I said, there were some benefits to it. Behaviorally, he did become a very compliant child. They did teach him a lot of like educational type things like puzzles and tracing and all kinds of stuff. But from a developmental standpoint, I didn't really see a lot of progress with the therapy. So we were doing ABA, we were doing OT, and we were doing speech therapist. He was actually diagnosed with pretty significant apraxia of speech around 3 years old. So we hired a private speech therapist in home that would come and work with him that specialized in apraxia. And when the first time that she met him, he was around 3 years old. And she said, I typically don't diagnose apraxia this young. But as soon as she met him, within about 10, 15 minutes of working with him, it was so obvious that he was dealing with apraxia that she had no problem giving him the diagnosis. Speech was really challenging for him. So in his mind, you could tell that he thought that he was saying the right sounds, but there was a disconnect between the brain and the mouth, to where the right sound wouldn't be coming out. And that'd be really frustrating for him. But his apraxia was so severe that she had estimated that he probably wouldn't even be speaking single syllable words until after the age of 7. And that was, again, really hard for me to hear. And I think that first year after his diagnosis, I was just kind of I was determined to figure out, how did this happen and what can I do to fix it? And I spent that first year after his diagnosis, every waking moment that I had where I wasn't caring for my kids, if they were napping or after they went to bed, I spent several hours every day researching anything and everything I could to help him. And I joined a bunch of these Facebook groups, and I'm so grateful that we lived in a time where we had those resources available to us, because those Facebook groups are honestly the reason why my son is in such a good place today, because of all the resources that have been shared with me, and other parents sharing their experiences of things that they did to help their child. And that gave you the idea of, let me research this. If it helped their child, maybe it can help my child. So I joined all these Facebook groups, and I had seen someone make a post about biomedical interventions. So again, he was probably about 2.5, 3 years old around this time. And then I started going down the rabbit hole of the biomedical intervention. So things like the dietary changes, detoxification, nutritional deficiencies, methylation, mitochondria, all these different supplement supports, and gut health. And once you kind of go down that rabbit hole, it really blows your mind, truly. And you start to realize that this is more of an environmental thing that's going on. This wasn't truly a genetic thing. And we'd done the genetic testing. It was all normal.
Oh, really? Oh, you did genetic testing?
We did, yeah. So our pediatrician, they did I think it's pretty common now that they do a microarray and then a Fragile X panel.
Mhm.
And I don't think I've met a single family where either one of those came back positive for something. They spent all this money on research, or all this research money on genetics, but they've yet to be able to tell us which gene it is that causes autism.
Mhm.
So anyways, I could talk about that. It's a whole nother topic. But so I started deep diving into kind of these biomedical interventions. And back then they had something called the DAN doctors, Defeat Autism Now. I think now they're called the Med Maps.
Mhm.
And at that time, my husband had just had a career change. We were a single income family. We didn't have a lot of money at the time. And so when I learned about this stand doctor, and I told my husband, I really want to take my son to one of these doctors, but they're so expensive, like $1,000 for initial consultation, plus the cost of all the testing and the supplements, and it's all out of pocket. It's not covered by insurance. And we just couldn't afford it. So I think at the time there was a nonprofit called Generation Rescue. It was Jenny McCarthy's
Mm.
nonprofit, where you could apply for a grant to be able to go see one of these doctors and have the treatments covered. And I applied for it twice, and we were never chosen for the grant. But I wasn't going to let that stop me. I was so determined that this is what my son needed, these biomedical interventions. And so if I wasn't able to go see a doctor, I was going to dedicate my entire life to learning how I could do all of this on my own. And so that's what I dedicated, the next few years of my life, to just learning anything and everything that I could do to help him and to improve his quality of life and increase his level of function. So when we started all these biomedical interventions, he was speaking in about 5 single syllable words, not even using them functionally. No eye contact still, not responding to name, not playing with toys appropriately. He had like stimming behaviors. His gut health and his diet was really poor. So one of the first big interventions that I ended up doing with him, and again, this is all me researching and doing on my own, which can be a little bit scary. You're pretty much playing doctor for your child, but as a parent who's desperate to help their kid, there's nothing I wouldn't do or try as long as it's safe. So one of the first things that we did for him was a heavy metal detoxification. And again, I just learned this through like reading books and researching online. And within 6 weeks of us starting this heavy metal detox, he was speaking in 4-word sentences. It was like watching a real life miracle unfold in front of my eyes.
Wow.
Uh, after
Wait,
he
wait. So you did this on your own, not with the doctor's help. You just did the heavy metal detox on your own.
all,
Like,
all
okay.
on my own. And again, at that time, we were really struggling financially, and
Mhm.
all of these supplements can get really so everything that we did was like natural herbals, vitamins, minerals, that kinds of stuff. Um, so when we first started this journey, I remember every month, when my husband would get paid, I'd be like, okay, this month we can try a probiotic. And, I'd have to like assess our finances and see what we could afford to try that month. And then I learned that you could buy vitamins in bulk powder really inexpensively. So I got like a little scale and I was measuring out all the things to make it affordable so we could get more of these supports on board for him. So I became really resourceful about finding ways to make this possible for us to be able to do these treatments and give him all the things that he needs. And he just kept responding to everything I was giving him. He was just getting better and better. And he actually ended up losing his diagnosis right after his 4th birthday. So we
Wow.
started this right. He was probably between 3.5 when we started the biomedical interventions, and by 4 years old, he ended up losing the diagnosis. So we went back to the same developmental pediatrician. He asked, what were we doing? And wow, he's doing so well. And at that time, we had stopped all the therapies, and I just wanted to focus on this. And I could tell he wasn't really supportive of what we were doing, but he couldn't deny the changes in my son. And he actually ended up changing his diagnosis from autism spectrum disorder to autism residual. So basically meaning, and that's the first time
I've
I'd ever
never
heard
heard
of
of
that.
that.
And I've never heard it again either. So um,
I think he made it up.
I think he did too. He just must have made it up on the spot. But what he told me was autism residual means that he once met the criteria for an autism diagnosis, but no longer does. So after that point, I would still say my son still had some speech delay and some other, signs of autism that we were still working on addressing or improving his level of function. So I wouldn't say that he lost all of his symptoms of autism around 4 years old. It took still a few more years of us doing more biomedical interventions. I'd say by the age of like 6 or 7, he was pretty indistinguishable from his neurotypical peers. So fast forward, he's in 6th grade now. He's in all accelerated classes. He's actually singing in choir this year. And that was his wanting to do too. We didn't push him to do choir. He wanted to do that all on his own. And I told my husband, like, it's really kind of full circle here because at one point we thought we might never hear his voice. And now here he is getting up in front of, it makes me emotional to talk about, but I'm just so proud of him. Um, Now he's up there singing in front of a large crowd of people, and he just amazes me. So my experience and journey with him kind of led me to this passion of wanting to help more families once I realized that this doesn't have to be a lifelong diagnosis and that there's more kids out there who could have a voice who don't have one. I just fully dedicated my life to wanting to get the information out there, get the resources out there, and help families. And sorry to backtrack, back in 2018, after we'd started these biomedical interventions and he had this rapid response to it, I created this video that I shared. It was on January 1st of 2018, so the first day of the new year. And I made this video, and you can find it on YouTube. It's labeled Nolan's Journey Autism Recovery. And I shared it on Facebook and it went viral. So in the first 24 hours, it had close to 300,000 views. I had reached out to this page on Facebook called Love What Matters, I think it's called. They had like millions of followers on their page. They reached out and they wanted to share the video that I shared. So they started sharing it, and that's how it went viral. Well, the next day, they ended up taking it down because they were getting a lot of backlash and hate from the autism community because his video insinuated that the autism was caused by environmental factors and certain medical interventions and things. And as you know, that's quite controversial. So they ended up taking the video down the next day, and instead they posted a video of a nurse inoculating a little child wearing an
Oh,
autism speak shirt. So that was kind
oh,
of like a big slap in the face.
whoa.
Yeah. So the video
Hmm.
was taken down
Yeah.
at 300,000 views,
Yeah.
but the one awesome thing that came out of it
Taken down
was
off of that page, but it's still on YouTube though, right?
it's still, yeah, it's still on YouTube. Yeah, but
Okay.
most of the shares where it shows all the views were from their
Well,
page.
from that
So,
page, yeah. Okay.
yeah.
Hmm.
Um, but yes, the video is still there. And one great thing that came out of it is so many parents were able to see that video and track me down from the video before it was taken down. And I had so many parents reaching out to me, ask me, what did you do to help your son? I want to do the same for my son. And it became to be so many messages that I couldn't keep up with it. So then I started a Facebook group, and the Facebook group is still there. It's called Health and Hope for Autism. And I started this Facebook group really just as a place to be able to share information and resources with families and help guide families on how to get started with biomedical interventions for their kids. Especially, my passion has always been wanting to cater to the lower income or middle class families that maybe don't have thousands of extra dollars laying around to be able to go work with a doctor. That I wanted them to know that there's still things that you can do on your own as a parent, that your financial status doesn't need to dictate whether you're able to do these treatments for your child or not. Because what a devastating thing to know that there is treatment options available, but you can't afford them. And especially during a time when the brain development is so critical and you have that window of opportunity to change the situation for them. I want this to be something that's really affordable and available for all families to do if they choose to take that path.
You didn't specifically mention though any particular inoculations that you thought were, part of the problem. Like, did he have a reaction? Did he get a rash, a fever, anything like that, or no?
Looking back, so he wasn't one of those cases of regressive autism. I think most commonly we hear of these stories where a child was having pretty normal development up until the 12 to 18-month age range. And then they go and they get the inoculation, and it's either a rapid change within the next few days or a slow regression over several months. So that was never the case for Nolan. He did not have regressive autism. He was developmentally delayed and showed the signs from early on, but he did have signs of not tolerating the inoculation. So, for example, I think at 2 months they do the rotavirus, the oral one, and he had a lot of GI issues following that. So he stopped tolerating certain formulas. That's when he became really colicky. And then around 12 months, he got the MMR, and he had a pretty um, significant localized reaction, like a skin reaction. So just things like that. It actually wasn't until my second child, and I had already been suspicious that those were playing a role, but I didn't know enough at the time to feel confident going to the doctor and declining them. And I wish I would have done more research then. But anyways, you do the
Well, I'm
best you
just
can.
curious because the people that didn't like your video were accusing you of that, but I don't hear you really talking about that.
So in the video, so the heavy metal detoxification insinuates that the metals from
Right, the
the
mercury that they keep in.
mercury,
Mhm.
aluminum,
Aluminum, yeah.
and then So it was actually not until my second son, Ryder, who is 19 months younger than Nolan. He was, I was watching him like a hawk throughout his infancy, and I was determined. I would tell my husband all the time, I'm determined that one of these kids is going to say mama, because still at that point, Nolan wasn't saying any words. So every day, like I would go to Ryder, my second son, and be like, mama, mama. So, and actually on Mother's Day of 2016, he did say mama for the first time. He was 8 months old. And it was ironic that it was on Mother's Day. It was the best Mother's Day present ever. So he developmentally was so much further ahead than where Nolan was at that age. He started walking at 10 months. He was saying a few words already. But then around 10 months, he got the DTaP, and he had gotten it late. So he was supposed to get it at 6 months, but he was sick at the time. So I canceled that appointment. I didn't end up taking him in. I didn't end up getting down to the pediatrician until 10 months. And I had already kind of been hesitant anyway. So I think in the back of my mind, I was trying to hold off as long as I could. Because again, I didn't have enough knowledge to be able to walk into the doctor and feel comfortable telling them my position on it. Um, and so after that, after he got the DTaP, I didn't hear him say mama again until after 3.5 years old. So my second son, Ryder, actually had a regression. Now, he was never diagnosed with autism, but he did have many red flags of autism. So the toe walking, pretty significant OCD. He had a ton of behavioral issues where Nolan was kind of very chill, go with the flow dude, just kind of in his own world, where Ryder was, gosh, there was a period of time where we didn't leave our house for like 6 months because his behavior was so awful. He would cry and scream from the time he woke up to the time he went to sleep. Severe OCD, like lining things up. If there was a dog hair on one of his toys, he would freak out. And it became a really stressful environment for us. So, the one thing though with Ryder that was very different from Nolan was he always had really good social engagement and joint attention. So I think that would have prevented him from getting an autism diagnosis. And I always joke that, not really joke, but I always say, I think Ryder was just one inoculation away from full-blown autism. Had I not stopped after that one that he got at 10 months, I think that he would have been in a much different position than he is now. So that's kind of what that pivotal point of us no longer doing those kinds of medical interventions or going for well visits, actually. So we learned that well visits were really for one purpose only. And it's not to make sure that your child is really well, it's to make sure that they stay up to date on those, medical interventions. So that was kind of my turning point of not doing that anymore for my kids. And then I shared with you before we got on the call that I have a 2.5-year-old. So I'll briefly walk you through my kind of journey with him. So he was born at 24 weeks. Again, I had severe preeclampsia. My pregnancy was going really well. And then right at 23 weeks, I woke up one morning and I was seeing spots, and I knew that was a red flag for preeclampsia, which I had with Nolan. So I ended up going to the hospital and they discharged me that day. And then 2 days later, again, I was feeling the signs and symptoms of the high blood pressure. So I ended up going back to the hospital, and my body was just going into full like shutdown mode. My oxygen dropped down to 80. I spiked a fever of 105. My liver enzymes were significantly elevated. I had protein in my urine. My body was basically just rejecting pregnancy, and they tried several medications to get my blood pressure under control. It just kept creeping up, and it got to a point where I was truly terrified that I was going to have a stroke. So he was 24 weeks, 4 days at the time. And it was the middle of the night. My husband was at home with the other kids, and the nurses could not get my blood pressure under control. So I made the decision. I told him, I said, I think I need to get this baby out of me because I have other kids at home. that need me, and I don't want to leave my kids motherless and my husband to care for a sick premature baby all on his own. So I had to make the decision going into that, knowing that he might not survive. But I had to also keep in mind that I had other kids that still needed me home. So that was a really scary decision to have to make, not knowing what you're going to go into, if you're going to survive, if your baby's going to survive. So, and throughout that whole pregnancy, I kept saying, this is going to be my do everything right pregnancy. I know so much more now. He's going to be my typical developing child. He's going to speak on time. And I think God really humbled me and said, joke's on you, because he ended up with the most severe form of speech delay. So he's not even just nonverbal, he's actually completely mute. So we don't even hear crying, laughing. There's no vocal sounds coming from him. So he had a really rough start. We spent 4.5 months in the NICU. He had several bowel perforations and emergency surgeries and an ileostomy. And about 6 weeks after he came
Wait,
home,
why did he have bowel perforations? What was
so
that?
he developed necrotizing enterocolitis twice. So it also was referred to as neck, if you've ever heard of neck. It's common in premature babies because their gut and their bowels is so underdeveloped. So when you start feeding them, if you go up too fast on the feeds, or if you expose them to cow's milk at a really young uh, gestational age, but he was already delivered, but he was only like 24 weeks when he was delivered. So they introduced him to milk and everything. So he had necrotizing enterocolitis twice. So um, they had trialed taking he was intubated. They tried taking his breathing tube out. And he had it out for about 2 days before he started to go into respiratory distress. So they tried to re-intubate him. And at this time, he was only 20, he was almost 4 weeks old, so he would have been around 28 weeks gestational age. So they tried to intubate him again, and they weren't able to get the breathing tube in. So he ended up going into respiratory arrest, and they had to administer chest compressions, epinephrine on this tiny, he wasn't even 2 pounds yet.
Yikes.
So whenever you go into respiratory arrest, your body shuts down blood flow to the GI to preserve blood flow and oxygen to the brain and the heart. So because that oxygen was cut off to his gut, he developed the necrotizing enterocolitis, which is a bowel infection that causes your bowels to die and perforate.
Yikes.
And it's about a 50% survival rate if you get neck. About 1 in 2 babies ends up passing away from it. Well, he ended up getting it twice. And between the 2 times that he had it, he had his bowels perforated in 5 places. So they had to cut and reconnect his bowels in 5 spots. He went under this major surgery at 2 pounds. So he got the ostomy, the little poop bag. We spent 4.5 months in the NICU. Once he came home from the NICU, we were home for 6 weeks before we had another medical emergency. So the part of the bowel where the ostomy was, it ended up perforating again right at the base of the where it's connected to the opening in the skin where they have the ostomy. And so the concern was that stool could leak into the bloodstream and cause sepsis. So we had to go in for emergency bowel reconnection surgery after he'd only been home for 6 weeks. And he was about 5 pounds, 6 pounds at the time, like super tiny still. And then we had several complications. So that PICU ICU stay for that time ended up turning into 13 weeks. So 5 weeks here in Vegas. And then they had to life flight us out of state because we don't have a pediatric ENT that specializes in airways here in Vegas, which is just crazy that, we're a big city and there's no pediatric airway specialist. So they had to life flight me with him overnight to Utah. And he ended up getting the tracheostomy tube. So I was out in Utah for 8 weeks by myself, living in the Ronald McDonald House, he was fighting for his life every day. Everything was really uncertain. We didn't know if he was going to survive or what his outcome was going to be. And my husband had to stay here in Vegas with the other two boys. So it was really hard on our family and our marriage to be separated and go through something so traumatic. So fast forward 13 weeks later, he got discharged from the NICU, came home with a tracheostomy tube. And that just really flipped our whole family upside down. So we had to learn how to care for this medically complex baby that required 24/7 care. And then it wasn't really shocking to me that he ended up also with an autism diagnosis. So he actually got his diagnosis just about 2 weeks ago. He's a little over 2.5, so he'll be 3 in February. And it was a lot harder for me to determine if it was autism or if it was truly just developmental delay, because, he was 4 months early and he spent several months of his life on sedation drips,
Hmm.
fentanyl, Presidex, ketamine, morphine, so many hardcore sedatives. We don't know what the long-term, developmental side effects of these things are. And in addition to that, he's had like 40 blood transfusions, over 20 surgeries and procedures, and just had so much different medications and things and so many antibiotics. I would have actually been shocked if he didn't end up being diagnosed with autism. Knowing what I know now and about the biomedical aspect of it and how it affects children from a biological standpoint, again, I would have been shocked if he didn't have an autism diagnosis after everything that he went through. So I can't say that I really was shocked. I felt like I still kind of went through a mourning period though, and it was still a hard pill for me to swallow that we were going through this again. I had told my husband previously, if we have another child that ends up with developmental delays or autism, I don't think I have it in me to go through all of these treatments again. Because it's a lot of work to do these biomedical interventions. It's a huge time sacrifice, financial sacrifice. But now that we're here, of course, I'm going to do everything I possibly can to give him the best quality of life. That's kind of where we're at today.
Wow.
So I think this
You've
is
really
just,
been through a lot. That is a lot to go through, especially with all the medical issues on top of it. It's a lot of trauma for you
it
to deal
is,
with.
it's a lot of trauma, but so many times we thought that he wasn't going to make it.
Mhm.
And so I just remember when he was around 2 weeks old and he was in that tiny little isolate, just begging and pleading with God, if he just survives, I'm ready to take on any chronic long-term medical condition, any developmental disorder. I'm ready. I just want him to be okay. So whenever I'm feeling down about where he's at developmentally, I just have to remind myself that he is a warrior and he's overcome so much and
Oh
he has
yeah.
such a strong will and desire to be here. And as long as he's here and wanting to fight, I'm going to do everything I can to give him the best quality of life. And he's like honestly the happiest little guy that you'll ever meet. Like he's always smiling, and I think he's just honestly just so happy to be here. He's just happy to be alive. So I've definitely learned so much through all my children's different experiences. And I think this is just my calling in life is to honestly raise 3 kids that had different needs. And I've learned so much from each child that I can now utilize all of this experience and knowledge that I've gained from my children to help other parents. Come out of this in a better place and help their children reach their full potential. And so I kind of look at it as a blessing in disguise. I used to say autism was both the worst and best thing to ever happen to me. The worst because it was a devastating and traumatic thing to have to go through, but also it really gave my life purpose. And I feel like um, something really good has and something really beautiful has come out of this, that so many more children are improving and recovering and getting the help that they need because of being able to share Nolan's story and the experience that that brought me to be able to work with families and help them. So I am so grateful that I was entrusted to be their mom and to go through these trials with them because it really shaped me as a person, as a mother, and now as a practitioner.
Oh, okay. I had no idea that you had gone through all of that on top of it.
Sorry, Cindy, was that too much?
No, it's just, it's hard to watch you cry and to not start crying myself, and we both sit here and just start bawling our eyes out. So I'm trying to.
Well, I feel bad for you because I'm normally not a crier, but like I said, you're the first
But
person.
you're reliving this. I mean, my goodness.
And you're the first person to ever interview me that I've been able to be asked these questions. I've always interviewed other people, so this is the first. I've done a lot of interviews locally about my son Asher for his medical stuff, but
Right,
never about the autism stuff. So just kind of reliving this trauma and but
right.
I think it's also important for parents to see the rawness and the emotion that comes
Sure.
goes behind all this because it is a hard journey. It's not all rainbows and sunshine.
Right, right.
And even though my kids are in a better place now, it was a lot of trauma to get here.
Yeah, yeah, for sure. Um, I have to tell you honestly, years ago, and this is how I talked about it in my YouTube videos when Robbie was here and I used to follow him around. Um, and when I heard people talk about how they thought that the inoculations were causing autism, I brushed that all aside as a bunch of nonsense because I was convinced that with Robbie, it was genetic. He was born that way because when he was born, he had a couple of issues and his development was delayed from day one. And it was kind of obvious that this was from day one, just like you with Nolan, there were
Yeah,
kind of issues from the very beginning. Um, but as I've interviewed so many other moms and heard their stories, I've, you know, changed my changed my view on this whole entire subject. Um, but if I were to just hear a mom that said she recovered her child from autism, my first reaction was, well, then your kid was not as bad as mine. Then you must have only had a very mild case, um, because that's only,
I'm
because I tried vitamin therapies and I tried these different things and nothing worked for my
right.
son. Um, I'm just being very honest. So,
No, I'm actually so glad that you brought that up, Cindy, because one of my kind of pet peeves. And I know there's going to be a lot of people that disagree with me on this, and that's okay. I think it's important to have the conversation. Is whenever people hear that aren't familiar with the biomedical stuff and they're not familiar with children recovering from autism, and they hear that my son recovered, they always say, well, then he probably never had autism to begin with. And the reason why that bothers me is because autism, according to DSM-5, which I think is the most current one, is just a set of symptoms. Nowhere in the diagnostic criteria does it say, well, you only meet the criteria if you meet all of these symptoms, but there's no environmental factors or so nowhere in the diagnostic criteria does it say what the cause of the autism is. It just says list of symptoms. So if you meet the criteria of symptoms, then you qualify for a diagnosis. Just because my son had heavy metal toxicity and all these other things uh, medically or internally that were going on, it doesn't mean that he didn't have autism. The autism were just side effects from those underlying health problems. And
mhm.
once we started addressing those underlying health issues, the symptoms just kind of vanished on their own. So to the people who believe that autism is such a amazing thing and it's a blessing and it's a gift, and why would you ever want to take that away from your child?
I don't agree with that either.
Yeah, are you insinuating that I should be upset that when I started giving my son vitamins and he no longer struggled anymore to communicate or connect with others, that I should regret the fact that he lost those symptoms. I think it's just
Yeah.
such a backwards way of thinking. Don't we want to set our kids up to be able to live independently?
Mhm.
I don't know of any kids that truly have autism and are moderately to severely impacted. I don't know any of them that would choose this journey for themselves, would choose to be able to not
Right.
communicate, or to be a prisoner to their brain and their body.
Right. And if you talk to any spellers, also the non-speakers, of
Oh,
course
yeah.
they would love to be to be healed of this.
Yes.
They're going through a lot of struggles. They
Right.
just ask them, not
Right.
even the parents.
Right.
Of course they would like to have help. And especially when you start dealing with gut issues and seizures and
Yeah.
all this, it's just nobody wants to live like that. Nobody wants to,
No.
you know.
No, or to, something as simple as being able to communicate when your head hurts or your stomach hurts, or
Mhm.
if you want to do something, or if you don't like to eat something, or you should be able to have an opinion and to be able to voice those things. And I just think giving a child a voice is a human right. And whether that's a spoken voice or some other form of communication, um, it is a human right, and every child deserves that. And I don't think that kids who are struggling to communicate, I wouldn't call that a blessing.
No. Okay, so you got into the whole biomedical field because there's some questions that I wanted to ask you about that. But so how did what do you do now specifically?
Okay, so now I'm a holistic health practitioner. So after I went to that whole thing with Nolan, I ended up going back to school and getting a degree as a holistic health practitioner. So prior to that, I actually did 2 years of the pre-nursing program. I wanted to go to school to be a nurse. And then when I started learning about the biomedical stuff and kind of going down the rabbit hole of holistic medicine, I just felt like allopathic medicine and nursing just there was a conflict of interest. I didn't align with that method of medicine anymore. So I switched gears. I enrolled in a school program, and I did this 2 year program to get a degree as a holistic health practitioner. And I graduated the end of 2019. And then beginning 2020, right before the pandemic, I actually started working for a local MedMaps doctor. So MAP stands for Medical Academy of Pediatric Special Needs.
Mhm.
So we have one local MAPS doctor here in Las Vegas. And he ended up hiring me as his clinical assistant. So for the next 2 years, I sat in on all of his autism appointments. I wrote all the treatment plans. I helped order labs. I listened to him review the labs, and I just gained a lot of clinical experience during that time, the kind of experience and knowledge that you won't get from any textbook or school. Because as you know, with autism, every child is so unique. And so getting that kind of clinical experience one-on-one, I definitely grew and learned so much. And then it got to a point where I felt like I could make more of an impact to families, working with them directly instead of assisting a doctor. I wanted to work with families one on one. And really, again, kind of going back to what really drove my passion was giving families an option to work with a practitioner that may not be able to afford or access a MAPS doctor or a functional medicine doctor, because it is very expensive. Some of these doctors are, thousands of dollars just for the initial consult. And again, I knew that that wasn't feasible for a lot of families. So I felt like there needs to be a practitioner that can cater to families who maybe don't have the means to be able to go work with a doctor, so they're not left to do this all on their own. Even though I know so many parents are capable, I did it. I know so many other parents can do it, but it's a lot of research and learning. And if I can help someone get there faster by having gone through it myself already, I think that was the benefit of being able to work with families and give them an option to work with a practitioner. So back in 2022, I started my own kind of
It was
remote
kind of
practice.
like seeing a nurse practitioner.
Kind of, yeah. So technically, I can't diagnose or I can't treat. I can only educate.
Okay.
So back in 2022, I opened up I made a website and I opened up my kind of online telemed practice. And my website is asdhealthcoach.com. I'm actually not a health coach. I'm a holistic health practitioner, but I'm providing health coaching services. So I can order labs, I can review labs with families, and I can help families come up with a targeted treatment plan uh, to meet their child's individual needs. Every child's needs and their path on this biomedical journey is going to look very different and very unique. So since 2022, I have consulted with almost 400 families in over 15 countries, and that's including taking a year and a half off after Asher was born. So after he was born in 2013, or sorry, 2023, I was off until November of last year. So I've just kind of been working again this past year. Um, and so that's where I'm at now is I'm just taking appointments and working with families directly one-on-one to kind of help them get on this journey to recovery. And
So you can't prescribe medications though,
I can't prescribe medications. So everything that we do is natural over-the-counter things. And
like
again,
vitamins and things.
vitamins, minerals, herbals. And again, I'm not treating, I'm just educating them on, well, if you give your child this, it can help with that. This is the
But you could
typical,
help with the right dosage.
exactly. So I can educate them
Yes.
on what doses we know through research and experience are most beneficial for therapeutic benefits. Because if you just go buy children's multivitamins and things off the shelf, our kids on the spectrum, they have so many nutritional deficiencies and metabolic imbalances that they need therapeutic dosing.
Mhm.
You're not going to see any changes or benefits by giving a child on the spectrum just, these low dose children's multivitamins. It really has to be targeted and therapeutic dosing for those
Right.
things.
Because there's so much that you can see online and on Instagram and everything of all these things that people recommend, but I would want someone that knows what they're doing to tell me how to
Yeah.
do it the right way.
Yes, that's the benefit of working with a practitioner, and not even just the dosing. It's like, well, what time should I give this supplement? Some of the supplements we give can cause hyperactivity and maybe it will cause sleep disruption. So knowing at what time of the day is the best time to give these things, which vitamins can be given together or which ones need to be separated, just all those little nuances and things that you only get through experience yourself. I've have the benefit of I'm going through this now with my third child. So I've kind of learned different, techniques and tricks and how to get these supplements into a picky eater. And, I've walked the same journey with these parents. It's one thing to be a doctor or practitioner who's telling other parents what to do, but unless you've actually walked in those shoes and understand, they don't truly get it.
Right.
You can tell a parent to give your kid these 10 supplements and be on your way. Well, how are they going to get those supplements into their kid? The kid only eats three things. How are we going to get them to take all these supplements and things? So I think that's kind of the benefit of families working with me is that I've been through this, and any problem that arises, I've most likely experienced it at some point. I'm going to help them kind of brainstorm and figure out how we can work through it. So that's where having that experience has been really helpful for me.
Right. There's different things that I wanted to ask you about. So the heavy metal detox, right? Like, so I've seen that on Instagram. I've seen people, advertising their detoxes. How do you know what is it's a good one, and how do you know if you're giving the right dosage?
So what we did was a protocol called Andy Cutler Chelation, or ACC for short. Andy Cutler was the doctor who came up with this detox protocol. And the reason why I went with this one specifically was because in one of the Facebook groups, they did this parent survey where they asked what was the most impactful protocol that you've done for your child. This was early on in our journey. And there was hundreds of parents that commented on this post. And I remember scrolling through because I wanted to do whatever the other parents did. If that worked for your kid, it's probably going to work for mine. So I was reading through all the comments, and the most common thing that I saw parents were saying help their child was this Andy Cutler chelation. So that's what kind of prompted me to then join a Facebook group that focused on just that protocol. And so I researched and I learned as much as I could about it. And so that's why I chose that protocol, was just based off other parents' responses. Now I know there's a lot of really popular detox sprays and things that are out there now.
Yes, that's what
And
I'm talking about. I see them. They
yeah,
spray under the tongue or whatever. Mhm.
and I'm not discrediting the responses and the progress that some parents claim to see with these things, but what I can say is if it's something that's really easy to do, it's probably, if it seems too good to be true, that just giving your child a spray can heal and recover them, it's probably too good to be true. There is nothing easy about trying to recover a child from autism. It's going to be a lot of hard work, a lot of different supports and things. I mean, at one point, I think I had him on probably 20 different supplements because it's not just the detox. You also have to support the minerals, support the methylation, the B vitamins, the gut health. And it's never just, there's not no magic pill that you can just give a child and they're going to wake up better. It's usually you need to support all the systems of the body. So it's a very complex condition to treat just because every child is so unique. And even if you have 10 kids whose all their labs look the same and they all need similar treatments, they're all going to respond to those treatments differently. And what might be really helpful for one kid, another kid can't tolerate. They just go off the rocker when you give them that one supplement. So it requires a very individualized approach, and that's what can make it really challenging to do.
Right. How is chelation done?
So for the Andy Cutler chelation, you're basically giving some additional support. So something called the core four, which is magnesium, vitamin C, vitamin E, and zinc. And the reason that you give these is because when you give chelators, which is just a fancy term for a detox agent, they kind of act like, think of like a mop. They go in and they grab the metals or like a claw machine kind of. And so in the process, it also depletes some of your essential nutrients. So that's why you want to make sure that you have them on the right vitamin and mineral support so you're not causing a deficiency in the process. You also want to support the liver, support the adrenals. Those things are, they go through a lot when you're detoxing. So in order to avoid side effects and to keep the protocol safe and effective, you want to have those supports in place. So those are supplement supports that you're giving daily. And then you're doing the detox where you're actually giving the chelators 3 days on, 4 days off. So we would do it starting on Friday all the way until Monday. And you're dosing the chelators based off their half-life for that full 72-hour period. And that's what makes it really safe and effective. Because when those chelators reach their half-life, so where there's not enough blood concentration for the chelators to be able to hold on to the metals anymore, it's going to drop those metals into the blood and they get redistributed back into the body or into the brain. And that can be dangerous. So what makes Andy Cutler chelation so safe is you're basically detoxing for 3 full days straight. You're getting about 24 doses of the chelator in with just one minimal redistribution at the end of that 3 day period versus a doctor who say wants to give a chelator one big dose 5 days a week. You're now redistributing metals 5 times in a week period. Whereas with Andy Cutler chelation, you're getting 3 full days of detox with one minimal redistribution at the end of that 3 day period. So you're moving way more metals out of the body than you're causing to redistribute. So that's what makes it really safe and effective. And what I can tell you from being in this field, in this community for almost a decade, is that hands down, it is what I would say, in my opinion, the most effective protocol out there for autism. Most of the recovery stories out there that I've come across, there was a common denominator that the parents did Andy Cutler chelation. There was actually a really great study that was conducted back in 2009, which is a bit outdated, but I still think it's relevant, where they did a parent survey of over 22,000 parents, and they compared different biomedical interventions, so things like dietary changes, supplements, chelation, versus allopathic or mainstream medicine interventions. So things like Ritalin, Risperidone, different sedatives and things. And they had 22,000 families survey the most beneficial or successful protocols that they did. And hands down, the number one rated intervention, and they rated about 50 different things, it was chelation. So chelation came in at 76% success rate, meaning that 76% of the families that did chelation for their child saw benefit from it. Now, that is a huge number when it comes to treating autism. 76%, that means 3 out of 4 kids are going to benefit from this. So when I saw that study, that was again confirmation that this is what I needed to try for my child. So that's kind of
And then
what,
when you tried it, his
oh
speech
my
started
gosh.
coming, right?
Oh my gosh, he had a miraculous response. Now, that's not, his response was better than the average of what we would typically see. Typically, what we see is slow, steady progress. It's a slow protocol. So parents always ask me, how long do I have to do this? And here's the kicker. It's pretty long. It's so if you read the books and you join the Facebook groups and you do your research on it, they typically say like 50 to 200 rounds. So one round would be one weekend. That 3-day period is considered one round. I think we did anywhere from 50 to 60 rounds. But I know families who've done 100, 150 rounds
So wait, so if you do it once a week for times 50, that's a year.
a year. Yep.
Wow.
So, yeah, we did it for quite a long time, but because it's a
I'd say
really,
I would have given up after a couple of weeks. I would have been like, this isn't working.
well, here's the thing though, Cindy, is, I documented and I journaled every weekend for the first, gosh, 3 or 4 months that we were doing this. I kept a journal. After every round, I wrote all the new things he was doing. So every week he was saying new words or doing new things, and it coincided with those 3 days that he was on the detox. So even though it is a long process, if you're seeing the clinical changes in your child and you're seeing the progress that they're making, it's so motivating to keep going. The other thing that typically turns parents off from wanting to do this protocol is during that 3-day period, you have to administer the chelators during sleep as well. So the half-life of the chelators that we were using were 3 hours during wake period when metabolism is faster, and then during sleep you can stretch it 4 hours. So on average, there would be 2 times in the middle of the night we'd have to set an alarm, wake up, administer the chelator, go back to bed. Now, it sounds worse than it is. So the kids sleep right through it. So it's you put a little bit of liquid in a syringe, it's like maybe 2 mLs of liquid. They're asleep on their pillow. You just squirt it into their cheek. It's going to prompt a swallow reflex, and the kid sleeps through it. But it's harder on the parents
Okay, so
because
they don't have to take a pill. They're
no,
not
no, 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 no.
swallowing a
I
pill in
mean,
the
you
middle of the
can
night.
take it in a pill if they swallow capsules, but then you'll have to sit them up and wake them up. And we know a lot of kids are struggling with sleep, and sleep is so important.
Oh
So
yeah, that would be the worst if you had to wake them
it
up.
would it would
I'm
be the
like,
worst.
you finally fell asleep and now I have to wake you up and give you pills?
I, yes, exactly. So that's why parents usually get turned off when they hear that they're going to
Okay.
have to wake up in the middle of the night. But I can say it's worse on the parent than it is the child. Because if you're like me, who's, likes to scroll social media in the middle of the night when I wake up and I have a hard time going back to sleep. So it was nice. My husband would do one of the middle of the night doses and I would do one of the middle of the night doses. So we kind of tag teamed and then it wasn't so bad. So we each only had to wake up one time.
First time I ever heard about chelation was many years ago. It had to be over 20 something years ago. And somebody's mother was going for it for something. And I got the impression that it was like a blood transfusion that she was having done.
So chelation, it's kind of an interchangeable word that's just used to describe many different methods of heavy metal detoxification.
Okay.
So if you Google chelation, some of the first things that pop up are that it's dangerous. And there was a child with autism that died from chelation. Well, if you actually dig a little deeper and read more about that one instance, the child was going into a clinic and getting IV chelation, which is a lot more dangerous, a lot more risky. They're giving really high amounts of the chelator, and there's a lot of that redistribution process that's happening. Um, well, if you read about that one specific incident, they actually administered, I want to say it was like 10 times the upper limit of the dose that he should have got. They administered the wrong amount and the wrong medication. And that's actually why that child ended up passing away, unfortunately. But it is very misleading for parents when they're Googling and trying to read about this. And that's one of the first things that pops up. They're like, well, I don't want to do something that could kill my child. So I would never recommend IV chelation personally. I'm not a doctor that can prescribe it, but I wouldn't take my own child to do it either, just because I know it's a lot more invasive and risky. It's okay to want to do anything and everything to help your child, but also our children aren't science experiments, and we want to make sure everything that we're doing is safe, first and foremost.
All right. What about parasites? I hear a lot about parasite cleanses.
Oh my gosh. So um, it's funny because, we started to track the moon cycles, and 'cause you would see certain symptoms of your child reacting or behaving differently around the full moon, because parasites are more active around the full moon. It has something to do with the gravitational pull of water around the full moon, and that's when parasites are more active. So commonly what we see with kids on the spectrum, if they are dealing with parasites, is that a few days before the full moon, you'll start seeing sleep will be worse, eating will be worse, stimming will be increased, they'll have more aggression, just tons of different behaviors. A common one, and it's kind of weird, kids would go upside down. So like my son would like to go on the couch and he would turn upside down and like stay on his head basically and watch TV upside down. And he would only do it the week of the full moon. So it was this parasites would trigger some of these odd behaviors. So yes, it is something that we do for kids. They typically need it just based off their symptoms, but we got really good at knowing when the full moon was. We didn't even have to look up the full moon calendar, just based off of their symptoms, like, oh, must be a full moon. And sure
Yeah.
enough, the next night you look outside and there's the full moon.
Well, they
But
say the hospitals and the jails always fill up when there's a full moon.
yes, well, I've asked my husband's in law enforcement, so I
Mhm.
have asked him, and he said, yeah, it's definitely, we can
It's a
tell when there's a
thing.
full moon. Yep.
Yep. That's the thing. I've never heard about that. But same thing with trying to do it on your own, though. I mean, don't we naturally have some type of parasites anyway? Like I've
Yes,
heard somebody mention you
yeah.
don't really want to clean out all of them because there is a
There's,
function that they're
there's
there for.
Yes, well, there's this misconception that if you live in a first world country that, it's clean, there's going to be no parasites. There's parasites everywhere. You can come in contact with parasites just from walking outside barefoot, from touching the handles on the grocery cart at the grocery store, from having pets. But the thing is, the average person's immune system should be so efficient that when you come in contact with these things, your immune system's keeping those pathogens or infections in check. Well, what we find with kids on the spectrum is they have this level of autoimmunity or immune dysfunction. So when their body comes in contact with things like parasites, viruses, bacterial infections, or fungal infections, their immune system isn't turned on and working efficiently or appropriately to kill these infections. So they kind of collect them in their body until you start giving them some like antimicrobials and things, and their immune system needs help, essentially. And a lot of that has to do with the gut stuff. The gut controls a lot of your immune system. So if your gut's not functioning or functioning well, or it's not in good health, then that will impair your immune response. And then we know that there's that gut and brain link. And that's what's so interesting about biomedical medicine or functional medicine is you really get to learn how all the systems of the body work together. Versus, mainstream medicine, they're just focused on symptoms and prescribing a medication to treat those symptoms. But they're not, a doctor might prescribe a cholesterol medication, and yes, it might help the cholesterol, but it's damaging other systems of the body. And so that's why I love this kind of method of medicine of, looking at the whole person and all the systems of the body and how they affect one another.
Yeah. Leucovorin. Very, 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 a lot of talk about that now.
Yes, I called it a fad, and some very upset parent called me out on Facebook for calling it a fad. And what I meant by that was there's a lot of popularity with it right now
Yes.
because there was a single case study, single meaning one child that had this rapid response, kind of like my son Nolan. He had this rapid response with chelation. So, of course, when these stories come out, every parent wants to jump on that bandwagon. Well, if this kid had that response, I need to try the same thing.
Yes.
Well, actually, leucovorin, it's not new to the biomedical community. It's been prescribed for over a decade.
Right.
The MAPS doctor I used to work for, he would prescribe it for almost every single one of his patients.
Right, but there's the magic word, he prescribed it. And this is what I'm trying to get out because there's pages for this on Facebook, and you have all these parents wanting to jump on the bandwagon and they all want to know, where can I get it? How much should I give my kid? They're trying to do it on their own. And I just think that that's very dangerous, that you
I
need to
think
talk to a medical professional before you do something like that. But the problem is they can't get any doctors to prescribe it because the pediatricians won't prescribe it because they don't know enough about it.
right.
So who can you go to? And I keep saying, find a MedMaps doctor. That's who you want.
So leucovorin is actually a prescription version of vitamin B9 folate. It's a specific form. It's called folinic acid. So not to be confused with folic acid, which is a synthetic, not good for us. Folinic acid is it's an unmethylated form of folate that can reach the brain. But you can get it over the counter in supplement form. So if you're a parent who their pediatrician's not willing to prescribe it, or you can't afford to go work with a functional medicine doctor for whatever reason, you just don't have access to it, you can supplement with the over-the-counter version. Actually, my personal opinion is that using the supplement version is actually cleaner. The pharmaceutical, like the main pharma brands, they actually have really bad fillers and ingredients that are toxic for our kids in them. Things like dyes, aluminum, and things like that, where some of these over-the-counter folinic acid powders you can get are clean of those fillers. But the problem is, without knowing your child's genetics, not genetics, epigenetics. So things like MTHFR status and things. Some kids do better taking a methylated version, and some kids do better with the folinic acid version. And then there's also additional supplement supports that your child should be on to help the body utilize and absorb the folinic acid efficiently. And there's also, if your child has cerebral folate deficiency, which is the condition that leucovorin is treating, which is a comorbidity of autism. I just totally lost my train of thought. Where was I going with this? Shoot.
Well, there's other things you have to do with it.
Yeah, other things you have to do. So you're going to want to put them on like different B vitamins. So all the B vitamins, they work synergistically together. A lot of kids experience a lot of side effects initially. I wouldn't say the medication's dangerous, or the vitamin, because it's really a vitamin. It is a water-soluble vitamin. So whatever your body doesn't utilize, you're going to pee out the excess. But it can be harmful for a child because if you go too fast moving up on the dose, there's going to be a lot of side effects. So things like agitation, aggression, hyperactivity, sleep disturbances, really significant
We have
side
enough
effects.
of that already. We don't need more of that.
Yes, exactly. And that's the other problem. Even if a pediatrician is willing to prescribe it, pediatricians are not trained on health and supplements and these kinds of things. They're just trained on medicating. Okay, so they don't know how does this interact with the other vitamins and yada yada. How should we titrate up on the dose? What side effects are too, like, what side effects would I see that would warrant me to have this child stop taking this medication if they're not a good candidate? I think that there's not enough training for pediatricians to safely and efficiently prescribe this medication. And that's another one of my big pet peeves right now, is that so many parents are getting this medication prescribed for their child and not having the right supports on board. So they're not seeing the full benefit of it, that they could be seeing if they worked with a practitioner or functional medicine doctor that is well versed on these things.
Right. When I interviewed Honey Rinicella, that was the first time I had heard of
Of
leucovorin,
the
right?
leucovorin.
But she said her son is on that. She said the prescription folinic acid, but also no dairy. He cannot eat dairy because it's blocking the receptors or something.
The antibodies, that's correct. And
Mhm.
also, being on a gluten-free
Mhm.
diet can also be helpful, because a lot of wheat and grains are fortified with folic acid, and folic acid and folinic acid, they compete, and folic acid will actually impair your methylation. So putting a child also on a dairy plus a gluten-free diet, you'll get the most benefit from it. And that's another thing, these pediatricians, they're not, familiar with these things and how they work. So they're not recommending for families to do the dietary part of it.
Right.
So
No pediatrician would understand any of that stuff.
no, I wish more pediatricians would start going to the MAPS conferences so they could be, you
Yes.
know, well, it's funny because,
Yes. There you go.
yeah. So
Go to
yeah,
the
if you're a
MedMaps conference.
pediatrician watching this, go to MedMaps,
Yes.
go
Anybody
see
in the medical
Honey.
field they want, anybody, nurses, doctors, anybody in the medical field, they want to go to their conferences and learn.
Yes.
Explain methylation because I'm not quite sure what that is.
Your methylation cycle, in layman's terms, it's just this cycle that is heavily responsible for many different metabolic processes, but especially for detoxification. And if your methylation is impaired, you're going to have depleted vitamin B12 levels, folate levels. And those things are really important for brain development and for speech. So a lot of times, I like to run labs on families when I'm working with them. And one of the labs that I like to run, it does check their methylation. And 9 times out of 10, we see pretty significantly impaired methylation in children on the spectrum. So that's where knowing about the different forms of vitamins and how to therapeutically administer them is really important. Because if you give the wrong supplement supports to some of these children, you're going to see negative side effects instead of seeing the benefits of it. But in a short, brief explanation, methylation does heavily control your body's detox capacity. So if our methylation is impaired, our body's not efficiently getting rid of the everyday toxin exposures. Our environment is toxic, our water supply, our food supply, different, just everything, even the air is more toxic today than it was 10 years ago. So we're having these everyday small exposures, but you and I, our bodies are able, our methylation's working good, our detox system's working good. When we come in contact with the everyday exposures, our body is actively getting rid of it on a daily basis. Well, our kids on the spectrum, they have this impaired methylation cycle. And instead of getting rid of the everyday small exposures, it just starts to accumulate. So, what we typically find is that it's not just one big exposure to these metals that caused, an accumulation of a metal toxicity. It's usually more commonly what we see is these small micro exposures since birth that have just been building up, building up, building up because their methylation is not working. And in addition to that, we typically also see really low glutathione levels. So glutathione is the body's master antioxidant, also controls detoxification. It's important for the liver. So we usually see really low glutathione levels. And this is kind of where that whole Tylenol thing comes into play. I know that's another hot topic, and people are
Yes, I
really
was going to say, wait, I've heard that word glutathione. Where did I hear that? Oh, yes, with the Tylenol. Tylenol lowers your glutathione levels,
yes.
which is
So
what helps your body detox.
yes,
I'm getting
exactly.
it. I'm starting to
Yes.
get it.
Your aha moment. um, so, and it causes something called oxidative stress. So when your antioxidants like glutathione are significantly depleted, we have this oxidative stress process that's happening. And oxidative stress measures the amount of damage that's happening on a cellular level. So we check their antioxidants, we check their glutathione, and usually those things are significantly depleted. So one way we can stop this um, oxidative stress process from happening is by supplementing with all these antioxidants and by getting the glutathione levels up, we're kind of jump starting the body's ability to start detoxing efficiently on its own again. The goal is never to keep kids on treatment forever. The goal is to figure out why all the systems of the body fell apart in the first place and put all those pieces kind of back together, kind of like a puzzle or a Rubik's Cube or something, and get all of the systems of the body back into balance or back into homeostasis so it can start doing all of these things on its own like it should have been doing in the beginning. And when a child reaches recovery, usually we've kind of fixed all of these impairments to where now the child doesn't need to be on the supplement supports anymore because they're maintaining their glutathione levels and their folate and their methylation.
That's what I was
And
going to ask. How do you get the glutathione levels back up? Through
so
supplements?
So glutathione is kind of interesting. So your body has 3 amino acids that are needed. These are the raw ingredients needed to convert to glutathione. So glutathione, it starts off as 3 amino acids, which is cysteine or NAC, if you ever heard of the supplement NAC. So cysteine, glutamine, and glycine. So some kids, they have deficiencies in one of those amino acids. So their body is not doesn't have the raw ingredients or raw materials to be able to efficiently convert to glutathione. So for those kids, when we check their amino acids, if those are low, then we start off by supplementing those 3 amino acids and giving their body an opportunity to try to start making that glutathione on its own. But then what is more common that we see is that the amino acids are in normal range. So we know it's not an issue with them not having the raw ingredients, but somewhere down the line, there's an impairment in their body's ability to convert those amino acids into the glutathione. And some of that can be driven by different epigenetic SNPs. Are you familiar with those, Cindy? So things like MTHFR gene mutation.
Okay, that was my last question, was explain the MTHFR because I hear that all the time and I really don't know what that means. I want
So
to explain that to
MTHFR,
me.
it's not a genetic um, abnormality. It's
What does it
epigenetic.
stand for?
Um, it's gosh, you're putting me on the spot here. It's methylene. Oh gosh, let me look this up.
Okay, I was going to say it must
It's a really
it
long
must have to
word.
do with methylation, the M in there, the MTH, yeah.
THFR. Okay, so it is. I used to be able to spit this off. So methylene tetrahydrofolate reductase enzyme. That's a
Okay.
mouthful. So MTHFR for short.
Yes.
So this is an epigenetic. So epigenetics, they turn on and off with our environment. They're not true genetic abnormalities such as like Down syndrome, for example. Like something like Down syndrome, those are your genes. You can't change them. It's a lifelong condition. Epigenetics, they turn on and off with the environment. So there's different genes other than MTHFR that we can check that account for things like your body's ability to convert glutathione or produce glutathione. So if we do one of these epigenetic tests to see your genetic predisposition to those deficiencies, that can be really helpful. So some kids might have a single or double mutation that impairs their bodies, either their methylation, their B vitamins or other vitamins, or their glutathione. Very, very common. I think I rarely see one child's glutathione levels come in range when we're checking them. Nearly all of them are depleted. So I thought it was just really funny or interesting when this whole Tylenol thing came out. And parents were in an uproar saying, how could they say that Tylenol causes autism? Well, first off, no one said Tylenol causes autism. What they said was that they found that there was an increased risk. And this is not for every child. So all the parents in the comments saying, well, I never took Tylenol while pregnant, or my child never received Tylenol and they're still autistic. It's not everybody, but the general population, what they're finding is that Tylenol is negatively impacting and putting them at a higher risk. And the reason is because it's lowering their glutathione. And with the increase in toxins in our environment, the increase of toxins being injected into our kids, if we're impairing the liver function and the body's ability to detox on top of an increase in toxic exposure, I mean, that's just a recipe for disaster. I just wish when the information came out about the Tylenol that they would have done a better job explaining why
I
it
agree.
can
Yeah.
have an effect.
Yeah.
And
That was the issue, that they just didn't explain it. That's
Mm.
all. And everybody just jumped on the I hate Trump bandwagon instead
Right.
of,
Oh,
all they had to do was just explain it. So now I have to do interviews like this to have people like you explain it to get the word out there so that people understand what they were trying to say.
well, and this is not new. Like us moms who've been in the biomedical world, we've known for a long time
Right.
how Tylenol impacts our kids negatively and depletes glutathione. And this is nothing new for us.
Mhm.
So they're acting like this is some big aha thing that was just discovered, and that's just not the case. But again, they're discrediting it based on the person who said it.
Mhm.
And that person did not conduct the research. Okay, the research was conducted at Harvard University. So for all the people out there that are saying, follow the science, well, if you actually read the science and you understand how the body works and how glutathione works, I mean, that's pretty scientific to me. I don't know how much more scientific you can get,
Mhm.
but I think because of the source of where the information was shared from, parents don't want to believe that it's true. So now you have all these people on TikTok who are chugging Tylenol and saying, "Look, I'm fine."
Yeah. Yeah. Well, that one mother died.
Yeah,
After
isn't
yeah.
crazy?
I mean, come on. That's just major stupidity.
Right. I mean, we know Tylenol causes liver damage. Autism aside, it's not healthy for you.
But
Eh,
they tell you when you're pregnant, don't eat cold cuts, don't eat sushi. I mean, like
Yeah.
there's the things that you're not allowed to eat now or touch. And how would you think that
Oh,
it's smart to drink a whole
well,
bottle
it's
of
it's
Tylenol?
funny you bring that up because it's like don't eat sushi because of the mercury, but we'll inject you with this that has
Right.
10 times the amount of mercury. Make
Yeah.
it make sense.
Yeah, exactly. Exactly. Oh my goodness. All right, listen, I've had you on for a long time, and I know that we can probably just keep talking forever.
I think we need to do a part two someday, Cindy.
Yeah, I know because there's so much in the whole medical end of it that we can keep talking about. But what I would like to do is put your contact info if there's people out there that need help. So does it have to be people in Nevada or it could be anywhere?
I work with families from any location, whether in the US or internationally.
Right, you said you had people all over the world that contact you, so that's good.
Yeah.
Okay.
And so they can find me on my website, so asdhealthcoach.com. I'm
ASD, Autism Spectrum Disorder, ASD Health Coach.
.com.
Okay.
And then there's a way to contact me through the website. I'm also run that Facebook group, Health and Hope for Autism. So this is a great, if you're a parent who's kind of new to learning about biomedical interventions and you want to deep dive and learn a little bit more, join the Facebook group. It's a
Oh,
really
perfect.
great resource. Doesn't cost any money. You can search the posts. I've made different getting started documents to help parents get started. So if you're a parent who's maybe not able to work with a practitioner, you just want to try and start a few like different supplement supports. I've made some getting started documents to help
Is it
families.
Health and Hope for
Health,
Autism?
health and hope for autism, yes. And it's
Is
just
is and spelled out or
health, yes.
okay.
And it's also just a really great community to connect with other families who are kind of doing these treatments for their children and walking the same path. And some of my closest friends that I'm still friends with today are parents that I've met in these biomedical Facebook groups. So they always say you need your village. So it's a great place to connect with other families and kind of learn from each other.
I'm convinced that any parent that has an autistic kid needs to go the biomedical route because, as you said, doctors, I'm not criticizing doctors in any way. But just in my experience of doing this for 27 years, I was tossed around like a ping pong ball between doctors that had no idea how to help my son. They didn't know, they just didn't know. But the biomedical doctors are the ones looking at root causes of disease, and they're the ones that seem to be specializing in the autism, and they seem to be the ones that know how to help.
Yes.
So,
And this whole autism recovery might seem new to people out there who maybe never heard that a child can recover. I know tens of kids personally who've made full recoveries. The most devastating thing to me is when a parent comes to me and their child's like 9, 10, 11 years old, and they've never heard about these sorts of treatments.
mhm,
And that has to be so devastating as a parent to know if I would have started this when they were 2 or 3 years old, that the prognosis would be so much better. I think at a minimum, every parent deserves to know this is an option that's out there.
right.
So I feel super passionate about just spreading the word that these kinds of treatments exist.
Yeah.
Um, and
Even for me, that I feel like Robbie was, neurologically, um, even if it was something genetic that he was born with, and there was something neurologically not right. Even so, the gut issues and the sleep and
oh
the things
gosh.
that you were talking about, he had all of that. He had the constipation from the time he was born, and the eczema and the ear infections and he had laryngitis. He was only 6 months old. He had laryngitis and he lost
I
his
think
voice.
I remember watching one of your videos where you mentioned about what 6-month old, loses their voice,
Right. Yeah, I don't. Right. Exactly. But, and so the more I learn from people like you, I'm like, oh my gosh, like,
Well, and
much of
actually,
what I didn't know, the things I didn't know. But even if you're saying, like, okay, maybe it's not a cure for autism, but if we can help all of the medical issues and the sleep issues and all those things, if all of that can just get better and they can feel better.
exactly. Well, and I really want to stress to parents out there, don't get caught up on the word recovery.
Mhm.
Recovery is going to look different for every family. So, for example, I might have a family that comes to me that their child like 17 or 18 years old, completely nonverbal, severely impacted, and their only hope and goal is to get the child out of diapers or to be able to sleep through the night or to fix their constipation. And we help them achieve that. We're looking at what medical imbalances are happening and how do we fix these. And we hope that by fixing those things, that it reduces their symptoms or challenges related to autism. But I never want parents to put focus on the word recovery. Let's just get your child to meet their full potential and get them to be the best version of themselves, um, and not get so focused on that word of recovery. Because you might miss all the other great things that came along the way if we're just focus on recovery. And I know for parents, the big one is always speech. But as we know through recent years, that there's other great ways that kids can communicate and live a good quality of life, even if it's not verbal speech. And just helping them to improve their motor planning so they can do things like spelling or PECs or whatever kind of communication is going to work for them. But to not get so hung up on just the speech, because you can still, like I said, live a great life, communicating through other methods.
Right. Yeah. It's just, well, especially your son that
Yeah.
doesn't have a voice. He's going to need a method.
Yes, so I'm trying to learn all the spelling stuff that I can now because I'm like, oh, this might be our journey someday. So,
Mhm.
um, and I love, hearing from the spellers because they're the first ones to really give us a true look into how it feels to be them. And I just think it's such a beautiful thing that they have a voice now. And even though it's not a verbal voice. It is a voice. It's them being able to share with the world their experience and what it's like to walk in their shoes, and that's so important.
Yep, yep, it is. Okay, Becky, thank you so much for being here today. I really appreciate it.
This was fun.
See, it wasn't so bad. Everybody's always afraid to come on, and
You
then
you weren't so scary after all,
no,
Cindy.
see, see, it's not so bad after all. All right, thank you again. You have a good night.
Thanks, Cindy.
That's it for today's episode. I hope you enjoyed it and it helped you gain a new perspective. If so, be sure to hit the like button and follow this channel to hear or see future episodes. Please visit our website at robbiesworldbook.com, where you'll learn about Robbie's World Foundation. We do retreats for moms and events for families. You'll also learn about our book series, Robbie's World and His Spectrum of Adventures, which was featured on the Today Show for World Autism Awareness Day. The series has 12 stories about a little penguin with autism based on the life of my son Robbie when he was a little boy. Kids of all ages and abilities love to read the rhyming stories, and meanwhile, they're actually learning some things about autism like stimming and eloping. If you'd like to actually see videos of Robbie and get to know him, visit our YouTube page, Robbie's World, and scroll all the way back to the beginning, and you'll see videos of him, and you'll see how this all got started.
Thank you for joining us today. Be sure to join us again on our next episode of Spectrum Perspectives.